Preventive care isn't one size fits all. What I check for you as your provider changes over time, and I'll walk you through it. In your 20s, I'm probably focusing more on the basic things like your blood pressure, your weight, your basic blood work, and we can throw in EKG to check your heart as needed. And we'll talk more about, family history, lifestyle practices, if you smoke, if you drink, if there's any depression and anxiety. Most people are healthy at this stage. So this is just more about building the record. And we'll compare everything to what is going to be happening later. When we get to your 30s, start more to talk about your cholesterol, your blood sugar, your blood pressure, especially when you have a family history of diabetes, high cholesterol, heart disease, thyroid issues. This is also when I start paying closer attention to stress patterns in your life. Are you sleeping good? You having stressors at your job? And also, we talk more about other lifestyle practices like, do you smoke? Do you drink? We start focusing more on that because all those things can affect your health over time. The things that you can do while you're younger and get away with it, as you're getting older, you can't do most of those things anymore. In your 40s, the screening frequency increases. So that's the time that you come to the doctor's office could go from once a year to twice a year when you get to your 40s. We get more into checking your lipid panels, that's your cholesterol levels. We're taking a closer look at your blood pressure, at your blood sugar, and depending on your history, we start to look at the patterns, making sure that these numbers are not trading up or down, as the case may be. And then we also talk about your heart health markers and the guidelines that surrounds all this. Also, at this point, as a female, we talk about getting a mammogram where you check your breast once a year. That's the recommendation. And checking if you have any family history of breast cancer and all that. And for the male at this stage in your 40s, we start talking about your checking your PSA, which is the prostate specific antigen test through your blood. So, depending on your history, we might decide to get you screened for colon cancer, which is called colonoscopy at this stage. In your 50s and beyond, we start specific screenings, of course, still doing the mammogram, the PSA, colonoscopy, definitely, which is the colon cancer screening at this stage, bone density, as the case may be. We start looking into some adult immunizations, like the shingles and pneumonia vaccines, making sure, those are up to date as needed. And we also take a closer look at how your lab has been trending over time. If I've had a chance to follow you in the last couple of years, then we can, check all that. The theme across every decade is the same. I'm not just checking a box for your age and saying, okay, you're 40, you're 50, all right, you look good and we'll see you next year. No, that's not what I'm doing. I'm building on what I already know about you so that each visit would add to the picture instead of starting all over. So we're building on what we already have and we're not just treating you as a number. And at that point, let's say I'm just meeting you in your 50s. So, and you haven't had a real baseline from other providers. If you do, I will ask for your records so I can build on that. If you don't have any records of such, that is perfectly fine. We can always start from somewhere. So, regardless of your age, that is always the right place to start. So, if this video applies to you, subscribe for more information, and also you can schedule a visit by clicking the link below. See you on the next video.